Hi, Dr. Phil Gatcha from the Functional Health Institute of Atlanta with our Gatcha coverage series. We're welcoming you inside the clinic today. We're just in the middle of taking care of patients and we need to draw some diagrams and some videos for you. This is part of a three-parter that's going to teach you how to build your immune system, your resilience against viruses, germs, bacteria, pathogens, and it starts with the gut. When you look here, if you build a better gut, you're going to have a better immune system. And so we have our little person here. We see the digestive tract and we draw a picture from the gut, and this is what I want you to focus on. When you look at the gut, it's called your intestinal mucosa. It's made up of these mucosal cells, look sort of like bricks or blobs, and they're seated right next to each other and they make a wall. Now, this wall is connected by something called tight junctions, sort of like a fence or mortar that holds the bricks together. Now, if you have something that breaks through this wall and enters the bloodstream, then your immune system has to activate. And prolonged irritation of the immune system, prolonged dysregulation of how something called your T cells works, puts you at a very big risk for viruses, germs, bacteria, infection, or immune system dysregulation. So let's go through the things that you can put into your gut that can mess things up. So the first thing is toxins. Where in the world are we not getting exposed to toxins? Next, proteins. There are certain foods that have proteins that destroy these tight junctions. Gluten, dairy, soy, they have materials called phytates, lectins, or something in egg whites called lysozymes, but gluten, dairy, soy, big ones. If you can remove them, you take out proteins that inflame and cause damage to these tight junctions, creating holes through which materials can get into the bloodstream. Next, we have pathogens, or I'm going to call them bugs for short. These are invaders, infections that you should know about through good blood testing. Next, alcohol. Alcohol damages neurons. Your gut is largely comprised of neurons. When you take alcohol, you cause inflammation to the mucosal barrier, the intestinal barrier. And last one, it's going to be other, and a big other is stress. The hormone cortisol thins and damages the lining of the gut. So when materials get through the lining of the gut, they enter the bloodstream and they begin to, before that, release inflammatory signals. So when these dietary proteins, these stressors, these toxins, these pathogens, they damage the mucosal barrier, the mucosal immune system. So there's immune system soldiers that live in this barrier, they activate. They release something called inflammatory cytokines, inflammatory chemical signals, and they also activate something called the NF-kappa B inflammatory response. And what that does, it contributes to these tight junctions, the spaces between the cells opening up. Now, that allows pathogens, toxins, dietary proteins to breach the intestinal barrier, to enter the bloodstream. When these things enter the bloodstream, they're picked up by immune system cells and it causes reactions in the immune system. That's going to be the next video, how the immune system gets affected, how it doesn't react. Remember, it's not the seed, it's not this virus going around, it's the soil. Can you build a stronger soil? So, some things to do to reduce inflammatory signaling, get any of the food materials or anything you ingest that's harmful out of the diet, out of the body. Some other things that can help with inflammatory signaling are going to be resveratrol. Next one is going to be turmeric. We hear this on a lot of these doctor shows where they're talking about turmeric's good. Well, turmeric and resveratrol are known to reduce those inflammatory signals. Next to those, there's something called SCFAs, short chain fatty acids. There's supplements you could take to get them. I like getting them through having a veggie smoothie, putting 1 to 2 cups of veggies in a blender, blending them to really small, and the fiber that's produced from those veggies feed the gut bacteria, help produce short chain fatty acids. And there's a material called glutathione. All right, so we want to stop the influx of materials. If you can't stop that, resveratrol turmeric helps to make this border a little bit more bulletproof, a little bit stronger. Then, if you're afraid that this protective barrier is compromised, ingesting short chain fatty acids or glutathione can help to interrupt that process. Protect the bloodstream in order to protect the immune system for when you need it. This is step 1. Step 2, get ready. It's going to be big. Dr. Phil Gatcha with part 2 of our series on how to bolster, build, and boom your immune system. So we've got all this worry in the news, and we have to be really careful when we're talking about microbes, that's bacteria or viruses. We're not making any claims. There is no drug or cure right now for this coronavirus. And so we wanted to offer a different utility solution for our patients to be able to find out and know, well, how does the immune system work and what can I do to build it? So in our first video, we talked about the gut. If the gut barrier system is working well, you reduce inflammation in the gut. If you're putting good materials in the body, you don't damage this protective layer of skin in the gut, you don't let things into the blood that shouldn't be there. We talked about some things you can do, some things you can avoid, and some things you can take to help build the inflammatory fighting power of that gut, but also to make sure that you're keeping that barrier intact. So the gut barrier, the skin barrier, the lung barrier, we want that strong so things don't get into the bloodstream. Now, what happens when something does get into the bloodstream? Our friend here called the antigen presenting cell comes into play. Now this antigen presenting cell is a friend. It grabs things that don't belong in the bloodstream, whether it's a food protein that slipped through the bloodstream or slipped into the bloodstream through the gut, or an invader like a virus. The antigen presenting cell, its job is to grab that offending molecule, and it's supposed to take it to what's called a naive T cell. Now you have these things called T cells that are part of how your body responds to an invasion. Now what we want to see is that something called a T regulatory cell gets pulled into play. T regulatory cells are for immune tolerance. They're to regulate the immune system, and T regulatory cells promote homeostasis, balance. This is the person that's going to get the infection. You can't hide from it, but it's going to make sure that your body deals with it the best it can. With chronic exposures, chronic bombardment of things getting in through barriers, you get chronic activation of these antigen presenting cells, and the T regulatory cells become dysregulated. They have a hard time maintaining homeostasis. So you're going to see something called Th1 cells come into play. You're going to see Th2 cells come into play, and something called Th17. Now this is what you're going to hear on the news that ends people in the hospital, that puts them on a respirator, that causes global physiology damage or symptoms. Let's go with Th1 is for cellular immunity. T regulatory cells are struggling to maintain homeostasis. Th1 comes in. Th1 cellular immunity brings about somewhat of an inflammatory response. Th2 then gets pulled into the mix. And Th17, again, these are for inflammatory signaling. In the literature and on the news, you're going to hear something about how corona triggers inflammatory cytokines. Well, Th1, Th2, Th17 trigger these chemical signals called inflammatory cytokines. Now, in this also, Th2 and Th17, this is where you get people with weakened immune systems, or people who are in what's called a special class of folks that need to be careful, called people with autoimmunity. Because when these guys get activated, you have what's called molecular mimicry. It's where the immune system has been angered so much by material getting in, by getting antigen presenting cells activating so much that T cells can't maintain homeostasis, so you begin to get molecular mimicry. The immune system begins to target self as an enemy, and that's the core of an autoimmune disease. Then last, and this is where you get the big body effects, something called an NF-kappa B response, nuclear factor kappa beta, which is going to be the topic of our next video, because that's the end stage result that puts somebody in distress, puts somebody in a hospital in need of a ventilator. And let's learn what nutritional strategies right now are known to intervene. So you're going to hear on the news, whether it's Dr. Oz or Dr. Jimmy down the street, you're going to hear how you want to get vitamin A and vitamin D, and what vitamin A and vitamin D help with is T regulatory cells. Also from the last video, short-chain fatty acids and something called glutathione help support T regulatory cells, homeostasis of the immune system. Just a smart thing to be using. Your doses are going to vary. Talk to your doctor, give us a call. The next thing is, if you want to support Th1 cell immunity, one of the major tools you can use, resveratrol turmeric. We're seeing curcumin. Curcumin is the active form or active chemical in turmeric, the active flavonoid. So you're going to hear this by the name curcumin. Resveratrol you're not going to hear as much about, but it's equally effective, plays a role in re-regulating, helping to bring homeostasis and calming down the inflammatory response. When it comes to Th2 and Th17, here again, we have the resveratrol and the turmeric make a huge difference and play a big role in calming that inflammatory response down, so your body can get back on track and fight the battle rather than going into a nuclear response. So this is part 2. Get ready for part 3. Thank you for spending time with us. Dr. Phil Gatcha here, Functional Health Institute of Atlanta. This is part number 3 of the immune tolerance cycle. What you can do to make sure your immune system is working properly. In part number 1, we talked about how there's triggers that damage the protective barriers, like the gut and lungs, and allow things into the bloodstream. What can you do to protect those barriers? In part number 2, we talked about what happens when invaders get into the bloodstream, how the immune system has to present the invader to your T cells. And if your T cells work properly, you have homeostasis. You fight the enemy, you beat the enemy, and you're now immune. In the next video, we're going to talk about what happens if you can't stop this inflammatory cycle, if the immune system is dysregulated, if you have this systemic inflammation occurring, and what it does, how it affects your body, and how people are ending up in hospitals right now. We talked with some friends in Louisiana that are running the CoronaVirus area for their hospital, and they're overwhelmed. And what they're seeing is overwhelmed with respiratory disorders. And really, we're seeing tissue damage in the body. So where it starts, let's say you didn't get your immune system regulated, your Th17, that's an inflammatory signal. Well, these inflammatory triggers increase something called nuclear factor kappa beta. Now, nuclear factor kappa beta tells the nucleus of your cells and the DNA in the nucleus to begin expressing an inflammatory state. It tells the cell, start sending out signals to the body globally and to all your friends that there's something wrong, we're inflamed. And it starts to make inflammatory proteins. So the DNA, you make inflammatory proteins. Now these inflammatory proteins go into systemic circulation, causing tissue damage. Where? Brain, joints, gut, lungs. Now these inflammatory proteins go back to make more of one of the initial triggers called cytokines. Cytokines are these cell signals. Inflammatory cytokines are the type of cell signals that make the cell angry. It makes the body then produce a greater NF-kappa B response. More DNA signals saying that you're inflamed, and then so on, more inflammatory proteins. And this vicious cycle has to be interrupted. Now what's interesting, even if we were to cut this corner off and we get rid of the initial triggers, even after you've gotten rid of the triggers, the NF-kappa B pathway still stays active. This is called a feed-forward self-amplifying loop. What it means is once you set this in motion, it's very hard to interrupt it. So this is where somebody who's got that infection feels like they're just falling off a cliff. Their body is physiologically getting worse and worse and worse because as this systemic circulation, inflammation is systemically circulating, you're getting all this tissue damage. So what doctors are trying to find is how to interrupt that. Again, what I said was there's no cure for corona, nothing that shows right now, but are there things nutritionally you can do to help your body? Yes, something we talked about in the other pathways for the immune system, something that can, and it shows promise with interrupting that NF-kappa B vicious cycle. There's your resveratrol and turmeric again. Again, this video arose out of all of our clients calling us and saying, is there anything I'm missing? It's not just one answer. This isn't a cure. This isn't a magical panacea. This isn't a panacea. Pangea is when the earth was all one big blob, right? All right, any event, this isn't any cure. This isn't magic. It's just simply what are the things that you can take and put into your body to give your system an advantage. This is how the immune system works, and it's irrefutable. So if you can support yours working better, then you've done yourself a favor. Be well, follow us on the Gatcha Covered series, sign up for the emails, and if you're a person out there needing help, feel free, contact us, get a conversation with myself or my beautiful camera woman, my wife, Dr. Bridget Gatcha, my bride now for 18 years, right? Yeah. 18 years, together for 23, ready to help you for another 40 more. Take care.